Good morning, Mr. and Mrs. Wilson. My name is Scott Topping, and I'm the registered nurse that's been assigned to David. As I understand it, David is being discharged to your home, and you will be taking care of all of his daily needs as David has suffered an anoxic brain injury. This is one of the most important health and well-being tasks that you'll be undertaking, as it ensures that David's nutritional needs are consistently met. The feeding formula has been prescribed by David's primary physician and in consultation with a clinical dietitian. It's important that the prescription dose and frequency be strictly adhered to, and if there are any problems, you should contact our offices immediately. You will be delivering 400 milliliters of the formula every 4 hours. I was asked to familiarize you both with the procedures that will be required to feed David through his gastrostomy tube so that you can both feel confident in your abilities, as well as keep David safe and healthy. The method I will be showing you today is known as the bolus method. By utilizing a syringe, you can accurately measure the amount of formula being given and dispense it in a controlled manner via the plunger. The bolus is in direct reference to one meal as prescribed for David's needs. During each feeding, David should be laying flat, but his upper body should be at a 30 to 45 degree angle throughout the feeding and for about an hour afterwards. So, here we go. Step 1, wash your hands. I know after the last year or two, we are all sick of someone telling us how to wash our hands, but nevertheless, it's extremely important in preventing cross-contamination of the formula, and this will help prevent any additional illness to David. Hands should be washed with warm water and soap for at least 20 seconds while making sure they include the nail beds and the webs of the finger, as well as the bases of the finger. I always wash my hands and sing happy birthday to myself twice. Just don't sing it out loud in front of people. It just makes you look kind of weird. If you're using an alcohol-based hand sanitizer, please ensure that you're covering all your hands, nails, and wrists. Make sure to rub your hands together until they are dry of all of the hand sanitizer. Step 2, get all your supplies that you're going to need ready. Nothing is worse than having to stop what you're doing because your equipment isn't in place when you need it. In an area with enough space to be comfortable, gather all your supplies. Some of the things you will need are formula, an empty container, a cup, a clean cloth, a container of drinkable water, and a 60 milliliter legacy catheter tip syringe, and some metal tape is a good idea. Medical tape, sorry, is a good idea. Step 3, open the plug at the end of the feeding tube. At this time, you're going to take note of the residual formula remaining in David's stomach. This will be accomplished by connecting the 60 milliliter syringe that has been filled with air to about 20 milliliters to the open end of the feeding tube. Push the air into the G-tube. Stop once resistance has been met. If an amount greater than 200 milliliters is returned, you will want to withhold the feeding until there's less than 100 milliliters of that residual remaining. If the amount is under 100, then it can be returned to the stomach, and you can continue with the feeding as you were. This is an important step in the feeding process, as too much residual can possibly lead to David aspirating the formula, and that creates an immediate choking danger and the possibility of longer-term consequences such as pneumonia. Step 4, fill the syringe with water to the recommended amount specified by David's primary physician, which is 30 milliliters. Place the syringe end into the now open end of the feeding tube. Unclamp the feeding tube. Push the plunger gently and slowly to flush the feeding tube with that 30 milliliters of drinking water. Step 6, reclamp the feeding tube. Remove the syringe. Step 7, wipe the top of the formula container with a clean cloth and pour the formula into a clean open container. Fill the syringe with formula and note the amounts carefully. Step 8, insert the syringe into the feeding tube and ensure that the catheter tip is secure. You can use a piece of medical tape to make sure the syringe doesn't disconnect from the feeding tube if you'd like. Step 9, implant the feeding tube and gently press the plunger until the syringe is empty. Reclamp the feeding tube. Step 10, disconnect the syringe and repeat steps 7 through 9 until the total amount that's been prescribed for David is reached, which is that 400 milliliters that we spoke about initially. This process should be completed over 10 minutes. Step 11, after the full amount of the prescribed formula has been given, you'll now fill the syringe again with 30 milliliters of drinkable water, unclamp the feeding tube, flush the tube slowly, reclamp the feeding tube, and disconnect the syringe. Step 12, cleanup time. Take apart the syringe, clean it thoroughly along with all of the other reusable equipment thoroughly, and put it away. Mr. and Mrs. Wilson, these are the steps that you're going to be taking each and every time you perform a bolus feeding for David. There are a few things that we want you to keep a watchful eye out for. We want you to call in immediately if you observe any of the following in regards to David and his feedings. If at the insertion site there's any bleeding, pus, redness, or swelling, we want you to report any changes in bowel function, such as no bowel movement for more than 2 days, constipation, or a significant change in bowels, change in color of urine or its smell, noted weight gain of more than 5 pounds in a week or a loss of 2 pounds in a week, any noticeable and unusual swelling of the abdomen, the feet, the legs, hands, arms, any vomiting, any diarrhea, any fevers greater than 100.4 degrees Fahrenheit, or shortness of breath. These are all concerns that must be relayed to us immediately for David's safety. So this is a lot of information we're throwing at you, and pretty fast. I'll be giving you a few copies of the steps for feeding. One of them has been laminated so you can keep it close by when you're preparing your feedings, just to make sure you keep it clean and out of the area that you're going to be preparing, so it doesn't contaminate anything or get anything contaminated. Please don't think that this is the end of our support for you, both as well as for David. It's just the beginning. We're here to answer any questions that you may have, and together we're going to work to give David a healthy and safe care. Are there any questions that I can answer for either of you? All right, great. Well, I hope this was helpful, and I look forward to hearing from you again.